Okay, بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Ramadan Kareem for all of you. Good evening all. I'm welcoming you all to our SASM educational series webinars. This is Dr. Rima Sadi, consultant pediatric emergency, will be moderating this session. My colleague, Dr. Amani Aziz Rahman, consultant pediatric emergency, is moderating this session with me also. Our topic for today is training and educational opportunities around the pandemic of COVID. My pleasure to introduce our speakers, Dr. Muhammad Zahir, Consultant Emergency and Director of Academic and Training Affairs at Prince Mohammed bin Abdulaziz Hospital, Dr. Rob Roger, Professor of Emergency Medicine, Vice Chair, Faculty Development, University of Kentucky College of Medicine. Welcome all, and please, Dr. Roger, mic is yours. Dr. Roger? Yes.
You hear me okay now?
Perfectly.
Okay. All right. Welcome. It's great to have everybody here. What we're going to talk about for the next 20 minutes, what I'm going to talk about is digital teaching during the pandemic. And this is something we should have been doing. A lot of us should have been doing this for a while now, but I think with the pandemic, it's forced us to do this with little to no notice. So obviously, COVID-19 has changed the way that we deliver education. We can't have live lectures, we can't have small group meetings. And from an education standpoint, some of us have become comfortable teaching in the digital space, but I would imagine that there's a lot of people who've just never done this before. The platform we're using right now, for example, is called Zoom. Some of you have used Zoom to watch webinars, but I would imagine that many of you haven't used Zoom to teach yet. And there's all kinds of buttons you have to get used to, and it's new technology for some people who've never used it. And so from an education standpoint, this has been sort of a wake-up call for what are we going to do in the coming months, years, with regards to education. As we go through this for the next 20 minutes, I'm going to set my timer here so I'm not over. Hopefully some of you will become excited about doing this, because we know for a fact that learners, specifically younger learners, want this type of education. They don't like sitting in boring lectures. They don't like PowerPoint presentations, and they want to be at home. They want to have their coffee, and they want to have, they don't want to be on camera. They just want to learn at their own pace. And so from a standpoint of where we're going to go from here, in the coming months and years, this is something we're going to be doing more and more of, because I think what we're going to find out, and certainly I've found out from my learners, is that a lot of learners like to learn like this. They don't like lectures. They hate lectures. I'm not saying get rid of lectures completely, but I think this is changing the way that we look at education, and the future really is now. It's happening already. So this is your typical learner. Many of you have taught, who've given lectures, look out in your audience, and this is exactly what you see: people sleeping, people not paying attention. And this certainly is something we face every day in education, trying to engage learners and get them interested. But this is the traditional way of doing it, is we've given lectures standing behind a podium. And for the small minority, this works, but for a lot of us, this is a very poor way to learn. And most of us as educators, this is the way that we're used to teaching. We're used to giving the presentation on stage or in front of an audience, and we're used to standing behind a podium, and we're used to, standing up in a lecture hall. That's what we're used to. And yet, as I sit here right now, I'm sitting in my home with a computer, with stuff going all around the house, at a desk, and I'm looking at a camera, and it's a little strange. And that's the part that you will need to get over as we learn more skills with teaching digitally, is how to look at a camera and how to engage an audience. Because most people, when they teach digitally, will do this. They will look at their slides, they'll look off like this at their notes, and then they'll go back to the slides, and they forget that the audience is right here. The audience is the camera. And so part of learning how to teach digitally is just getting used to teaching digitally. You have to practice it, you've got to do it a few times. But I guarantee you, if you learn a couple of the things we're going to talk about, you're going to be more comfortable doing it. You'll be more engaging as you do it, and your learners will actually appreciate it. And the cool thing about it is you can do it anytime you want. You don't have to have a lecture hall set aside. You can do it from home. You can do it from anywhere, and people like it. The other thing that this has allowed us to do is it's kind of forced us to be creative and innovative with the way that we teach. Some of us were doing this kind of education before COVID-19 even started, but a lot of us have never done it before. And I would imagine that the audience has at least some people in it that have never done it. They're fearful of doing it. They're not sure how to do it. And hopefully at the end of this, you know, I've got about 17 minutes left to reassure you that this is really easy and that learners actually prefer this. I really do think a lot of learners prefer learning like this. So it's just something that we're going to have to get used to. But it's forced us, the pandemic has forced us to think of different ways to educate and engage learners, because we know we can't do it for now, we can't do it in a lecture hall. The thing that I think learners like about this, and the reason I say just get used to this type of education because it's here to stay, is learners, and when I've done or been involved in resident lectures where I work at the University of Kentucky just recently, I'm sitting here in my home, I'm on my computer, and I can see the faces of all the people or some of the people in the audience, the residents, and some of the residents put up their picture, not a video, or just their name. But it's kind of a relaxing way to learn because their face is not being shown. There's no pressure to, you know, raise their hand and ask questions. They can drink their coffee. They can sit, you know, and wear whatever clothes they want to wear. They can, you know, sort of do as they please. And for a lot of people, for younger learners, that's a really comfortable way to learn. The old system of go to a lecture hall and sit in a boring lecture for 1 hour, 2 hours, 3 hours, you know, if it's a good speaker like Amal Mattu or someone who can keep you awake, or Jamil can keep me awake with his lectures, then that's fine. But a lot of people can't do that. And we now know that learners, you know, let's face it, I'm not young. So the way I preferred to learn is different than today's 20-year-old. And a lot of people prefer to learn on their own time. They prefer to be at home. They prefer to have distance learning and to do it in the privacy of their own space. And that's just the reality. However, students, residents, learners all around the world have, particularly medical students, can be stressed about this and anxious about, usually the question is, what's going to be on the test? Are the slides going to be on the test? And it's, although they're technically savvy, they're not necessarily used to learning like this. They are still used to going to boring lecture halls and sitting there and getting the PowerPoint presentations. And that's just the way it is. So they are going to be anxious about this a little bit. They may be anxious about their Wi-Fi. They may be anxious about, they couldn't hear the speaker. If you ask students and you know, about this type of learning, some of them they're going to be stressed and anxious about it. And so part of being a good digital educator is, first of all, realizing that sometimes technology will fail and that you will have to reassure students after you've given your presentations or small groups that you can follow up with them on social media. You can use WhatsApp. We'll talk about those in a minute. That the lecture that I'm giving right now, for example, doesn't have to be the end of the education session. It's just the beginning. Whereas if you give a traditional lecture, you give your lecture, you finish, and that's it. So sometimes you'll have to reassure students that there's more to this than just the session that's going to be held on, in this example, on Zoom. But as an educator, the cool thing is we kind of get to recreate the learning space. Most of us are used to a learning space that is in a classroom, I'm not going to talk about bedside teaching, but the learning space usually is in a classroom, and it's students sitting there passively watching the talk, taking notes, and that's fine. But as educators now, COVID-19, I think for many of us, has forced us to rethink that space. The space right now is me, my laptop, Zoom, the space you're sitting in, social media, WhatsApp after the fact. And so we're going to have to be creative with how we interact with learners. And that's why I emphasize looking at the camera. It takes some effort. And I'm going to show you how to do that in a minute. It takes effort for me to look at the camera, because all I want to do is look at my slides. If you look at most Zoom presentations or most GoToMeeting or whichever platform you're talking about, most people teach by looking at their slides. If you look at me right now, I'm just looking at my slides, I'm looking at my slides, and they don't engage the audience. That's the equivalent of me standing in front of an audience, not looking at my audience. So it's perfectly acceptable, because keep in mind, you want to create a comfortable space for the learner. So look at your audience, make some hand gestures. It's okay. You're going to have to change the way that you get comfortable with this, because most of us are comfortable giving a lecture. We're just not used to doing this digitally. But this is the space that we live in now. This is a Zoom meeting, at least I think this is a Zoom meeting on this slide. And this is just the way it is. For many of us, this is very, very new, and it's uncomfortable. And it's going to take some practice. But just keep in mind, if you practice and get good at this, a lot of learners prefer this. So get good at it. When you look at comfort level as an educator, myself, in my 40s, comfort level changes as you get older. And as you go from your 20s to 30s to 40s into your 50s and even 60s, you become sort of set in your ways. You like to give presentations a certain way. You like to give your slides a certain way. You like your slides to look a certain way. And that's normal. We become a little bit more rigid as we get older. This pandemic has forced us to not be so rigid with how we educate. And so learning how to use these platforms, if you're going to be an effective educator, is important, because this is where learners are. This is their reality. And even when the pandemic is over, even when we go back to teaching in the classrooms, I think we're still going to be utilizing platforms like Zoom more than we ever did, because we're going to realize that learners prefer this. They like this type of education. So I know that many of you are uncomfortable. You have a certain set point of comfort level with how you teach, and now you're out of your comfort zone. But being out of your comfort zone is a good thing, because it forces you to change. It forces you to adapt and get better and stronger and resilient. So it's okay to be uncomfortable. It's okay to realize I'm not good at teaching on Zoom. And because none of us were good when we first started giving presentations. We had to get better. We had to practice. So this is going to take some practice. One of the most vital things about this, I think, is it's okay to give a good presentation. It's okay for your learners to say that they sat during the Zoom call and they heard it. But particularly for younger learners, it's going to be vitally important to follow up with them and develop some type of system for following up with them after the talk. For example, WhatsApp, very easy to use. You could simply form a WhatsApp group of the people in your lecture group on Zoom, and people in your group can ask questions of you as an educator after your talk. You can follow up with x-rays or images, articles, things like that. What you don't want to do is just give a talk and that's it. Learners are potentially going to feel abandoned. They're going to feel like, I don't know what to do with myself. So they want to feel connection. That's, you know, the 20 and 30-year-olds, particularly the 20-year-olds, the millennials and earlier, they want a sense of connection. And so building into this is going to be building a sense of community, not just giving your talk and then closing your laptop, but following up with them on WhatsApp or a Facebook group, something, some form of social media. You can do quizzes and things like that, but forming a bond with these learners is going to be important. I think WhatsApp is probably one of the easier things to use because you can do it after your talk for, any period of time that you need. They can ask questions, you can follow up with them, you can give them assignments, things like that. So that's a really important point of digital teaching, is you're not just creating a space digitally, you're creating a community. And with that community, you should involve something like a social media app, something, so that there can be communication after the fact. Now, a new educator or an older educator who's never done this before is going to look at this slide and can be a little overwhelmed. If you've never used this to teach before, you're going to make a ton of mistakes. You're going to hit the wrong button. Hopefully you can see my cursor here on the lower left screen. One of the bigger mistakes is, and this is not really an education mistake as much as it is an embarrassing mistake, is I've seen people forget to unclick the mute button, and they're not speaking, and they're having a conversation off camera with someone that can be kind of embarrassing or personal. So learning where the buttons are, learning how to share your screen, learning how to set up the call, learning how to send the link to your learners so they can click on it and go right to the meeting. Those things take time. So just be patient with yourself. This technology is here to stay. Learners like it, so get good at it. There are lots of platforms out there. There's Zoom, GoToMeeting. I just heard of one recently called Microsoft Teams, I think it's called. Google Hangouts, I'm not sure if that's actually even still around, but there's a number of platforms out there. Zoom tends to be the most popular where I am, but you just got to learn it. Just like you learn how to give a PowerPoint presentation, you need to learn the technology. And if anybody in this audience ever wants to meet with me personally after this pandemic or via a Zoom call, I'll teach you how to use it. I'm not an expert, but I can show you some ins and outs about how to get good at it. So get used to it. This technology is here and it's going to stay. But you're going to have some stress as an educator. Educators were stressed already, and now they have to learn something new. And now everything's being turned upside down. This is also true of non-medical educators, high school students, teachers who are teaching kids have to learn how to use this stuff. The kids know how to use it very well. So the technology's here, it's going to stay. I know you're stressed, at least some of you, but if you practice just a little bit and talk to people who've done this before, you'll get pretty good at it. You can go to the Zoom website. There's a ton of videos on how to start meetings. There's videos on how to share your screen, very short videos, very well done, easy to follow. And again, I'm sticking to Zoom, but you could talk about any of these, such as Microsoft Teams or GoToMeeting, but you have to know your platform. Know your platform, little things like where's the mute button, how do you add participants, things like that. And if you practice, you'll get pretty good at it. One of the things I would recommend here, a couple of tips, is if you can, try to get hardwired internet. If you're in a place with poor Wi-Fi or spotty Wi-Fi, your video could cut in and out, and be patient with yourself, first of all. Technology is going to fail sometimes. It just is. So just be gentle on yourself. Don't worry about it if things don't go perfect. You may have to reschedule if the Wi-Fi or the internet's down in your building. But I think it's probably better to get hardwired internet if you can, because it's more reliable. The other thing, which is sometimes impossible to control, is noise. Dogs barking, babies crying. Sometimes you can't avoid that. Phones ringing, someone coming in the room. One of the funniest examples, it wasn't funny for this guy, was a guy being interviewed on CNN, and
they actually try to do the procedure. So we need them to arrive at that mental state where they register each deliberate step of the procedure and then combine them together into one fluid motion. So when we're teaching them, even when we're teaching them verbally, or like, for example, when they're watching a video about it, even before they even touch the patient or touch the mannequin, we want to break that procedure into steps. So, okay, you're going to do direct laryngoscopy. So you're going to check the light of the blade, step 1. Step 2, you're going to hold the blade in your left hand. Step 3, you're going to, position the patient's head. And we want to make sure that they understand the steps step by step, and they separate them from each other, and they are able to verbalize them before even trying the procedure for the first time, because that memory sticks when they are actually during that stressful time of actually performing that procedure on a patient. So this is their fallback. If they haven't registered it in their mind, chaos ensues. And you want them to be able to close their eyes and imagine it, because they should have seen one being done on video or seen an attending do it. You want them to close their eyes and be able to imagine how they will do the procedure, how they are going to hold the blade, how they are going to open the patient mouth, etc. And this guided imagery gives them something to fall back onto when they're doing the procedure, and also anticipate difficulties. And that's something we're going to elaborate on in a while. And of course, they need to practice. We just talked about how COVID is kind of limiting training opportunities, especially using simulations. But so training doesn't have to be on an expensive mannequin. Training doesn't have to be using expensive equipment. It doesn't have to be in a simulation lab. As long as, and there is evidence to back this up, as long as the learners are going through the same motions, they are moving their hands in the same way, they are inserting the instrument at the same angle, that knowledge sticks with them. So there is a huge, remember when people were learning suturing on orange peels? That was kind of what low-cost simulation is about. So if they're doing the same actions, even if it's not the real patient, this knowledge and this experience, this muscle memory transfers to them during the actual procedure. So they need to train on it multiple times, even if they're not doing it on an expensive mannequin, but they need to train on it, and they need to be supervised. And I think with the current era of Zoom and using video, this is a great opportunity for people to be training at home and be supervised with that as well, especially if they're coached by someone who can correct their steps. And when they are doing the procedure, when they are actually doing the procedure, this is an amazing chance for learning. A lot of us are going to go to our learners who couldn't intubate a patient. And I strongly encourage you, when you go back and see a resident who couldn't intubate a patient, ask them, do you know why it didn't work? And surprisingly, a lot of times the answer is no. And I think that I don't believe that we become experts by gaining more knowledge about intubation. I think that we become experts by knowing how to troubleshoot better. So troubleshooting is actually as essential as knowing the initial steps of doing a procedure, and encouraging learners to analyze the situation and teaching them tips that allows every failed procedure to be even more beneficial than a successful procedure. So they're getting something even out of the procedures that they didn't complete. So identifying what went wrong and how they could correct it the next time. And finally, I'm going to be talking about the reading dip. So we talked about how this atmosphere is very different, and it is expected for our learners for their performance to change. It is expected for their, let's say, dedication or willingness to read. Some of that might change. It is the environment around them is different, and that's a normal and expected response. But it's about what we can tell them, or what advice can we give them to navigate that. So they need to be reading about things that are relevant. So it is very difficult for us to read something or to do anything that we don't feel is beneficial. So if they're not in the mood to read anything, then it might be easier for them to just read something that they've seen before, a case that they've seen today, a topic that they discussed earlier, a topic that's in the academic activity if they are having an academic activity. So something that's related, something they can build on. And building their endurance, which is most probably the number one reason why people wouldn't be interested in studies, because they get bored. They're not, they're just not in the mood. And things that can help with that is just doing chunks of reading every now and then, instead of wanting to do a long session of reading. So I'm not sure if any of you heard of the Pomodoro Technique. So Pomodoro is the tomato timer that you see in the on the top here. So that's a timer that only goes to like 50 minutes or something. And the guy who invented the Pomodoro technique, he theorized that dividing the task times into smaller chunks helps people commit. So the idea is basically to set a timer, and there are a lot of apps online. If for all platforms, if you look up Pomodoro, you're going to find a lot of apps that can help you do that. You might want to set an alarm for 20, 25 minutes, 30 minutes max, and then do nothing for these. Force yourself, or force, for the learners to force themselves to actually commit to that job for the next 20, 25, 30 minutes. And the good thing about apps is that they kind of give you they gamify the process. So one app is gonna, once you set the timer, it's gonna start growing a tree for you. And if you exit that app, to check your messages or do whatever, that app is going to give you a very sad message that you've just killed your tree. And it's just, it sounds silly, but it's kind of gives you kind of a reward system of, hey, maybe I want to commit to that. Maybe there are consequences to me breaking my concentration earlier. And that basically compartmentalizes the reading into chunks. So 425 chunks, that's like an hour, and then, a couple of breaks in between. And after a set of usually 4 Pomodoros, so that's like 100 minutes, that's 2 hours, you take a longer break. And that technique can help people build their endurance and be more committed to actually reading. A lot of technology exists. Yes.
1
I'm almost
minute
done.
and then we'll take a question.
Almost done.
Okay.
Yeah. One other way is to utilize the dead time. So, using podcasts or voice apps that to read knowledge for you, using that on your way to the shift, during meals, before you sleep, etc. And also spaced repetition and interleaving. So instead of forcing oneself to do a long chunk of studying for a couple of hours, so reading a topic and then leaving it and then coming back to it after a week or two, that actually registers it better in your memory, especially if you interleave it or mix the topics. So read a topic for a short time and then read another one, and then after a while go back to the first one. That all of these are strategies are proven to actually make the memory of the topic that you read stick better. And finally, it is important for learners to realize that what they're going is not only their problem. Other people are having that problem as well. So making them commit to a group helps them stick to a schedule. It gets them to have richer discussions, gives them some, they could go through the same joy or suffering together. And now with, the proliferation of online apps, they can use technology to have their distance reading sessions as well. So I hope these tips are going to be helpful to you as educators and your learners. And if there are any learners also in the group, thank you for your time. And you're most welcome to reach me through these links. And I'm happy to take any questions.
Thank you, Dr. Zahar, for this great presentation. There is this question from Dr. Hassan Ayub, and he was asking, do you think this is going to, during those situations and the COVID-19 era, do you think this is going to affect the training of the residency program, especially if this is continuing for a long period of time, because you're unable to give them the most what they actually use and learn during the increasing the cases number because of the number is less than others?
So we have to acknowledge that this will affect training, but here's the thing. I think that number one, there are ways for us to mitigate the damage. So as Dr. Rob talked and even in my talk, this is a chance for us to do things better. And maybe by implementing some different techniques, by changing the way we do things, number one, we might decrease the effect that this pandemic is going to have on our training, and we might actually ourselves and as learners learn new things along the way. But is it going to affect the quality of the training overall, I think there's no avoiding it. I think it's the training